Now, there's a growing number of voices against the vaccination of children against COVID-19. 4 organizations, including the ACDP, have taken the government to court over this. And some parents are reluctant to get their children vaccinated. So to discuss this hesitancy, we're now joined by Sara Cooper, a senior scientist at the Cochrane organization. Sara, thank you so much for your time this morning, and good morning to you. That hesitancy coming in not only from, parents, but also various interest groups and organizations, including the ACDP there as a political party. Where do you think it comes from? Is it lack of, information, understanding? How can we better understand hesitancy in vaccinating children?
Yes, thank you, Tumelo and Gareth, and thanks for having me. I think what we found, we recently conducted a Cochrane review where we looked at studies with parents around their views and experiences and practices of childhood vaccination. And what we really found is that many complex factors actually influence what parents think and do around vaccination. So, for example, their broader worldviews about health and illness, the views and practices of their social networks make a big influence. We also found wider political issues and power relations, and particularly how these kind of impact on parents' trust or distrust of those associated with vaccination programs. And then also parents' access to and experiences of vaccination services and healthcare workers. So I think importantly, what we really found is through their vaccination choices, parents are often communicating not just what they think about vaccines, but also who they are, what they value, who they identify with. And so I think it is important to realize that often when parents and others decide against vaccination, it's actually not necessarily about a lack of information or irrational forms of thinking, as is often assumed, but rather it really forms an integral part of the social worlds in which people live.
Yeah. So is the hesitancy that we're seeing from parents only isolated to South Africa? How are we faring, I suppose, my question, to other countries in terms of their vaccination policies when it comes to children?
Yeah. I mean, I think in South Africa, there's the majority of South Africans and South African parents are accepting vaccination for their children. It's a minority that are not accepting routine childhood vaccination. And globally, this is a phenomenon. We're not worse than other countries globally. It's happening globally that people are not wanting to receive vaccination for their children. So it's not just a South African phenomenon.
With that being said, Dr. Sara Cooper, and I'm saying this because we've seen different countries now, saying that if you're not vaccinated, you would not be allowed in certain, public areas. Some organizations, even around the world, or even companies, saying if you're not vaccinated, you may not be allowed back at work as an employee of that country. Should we expect the same for unvaccinated children? Should we expect perhaps a conversation in future, possibly around, children that are unvaccinated being prohibited from attending school?
Yeah, I think the conversations are now really happening around mandatory vaccination. And I think that we can definitely see that this is going to be a topic that is going to come up. I think one does need to separate the issues around COVID-19 vaccine hesitancy and mandatory vaccination for COVID-19 and more routine childhood vaccination. And I think it's important not to blur those issues in the debates and the conversations going forward. And I think the jury's out still whether we will and whether we need to start implementing mandatory vaccination for childhood vaccination.
All right, we'll leave it there. Dr. Sara Cooper, thank you so much for your time this morning, talking hesitancy that we're seeing in some parents when it comes to vaccinating their children.